And hello and welcome everyone to the SHSMD webinar, True Enterprise Feedback for the Patient Experience. SHSMD would like to extend a sincere thank you to CustomerCount by Mobius Vendor Partners for sponsoring today's webinar. Before we begin, I'd like to cover a few housekeeping items. First, this webinar is now being recorded and is broadcast in listen-only mode. We welcome your comments and questions throughout the presentation. Click the chat icon in the lower right-hand side of your screen to enter your questions or comments, as we have allotted time at the end for Q&A. Please select the All Panelists to direct your questions to the speakers. Now, before I hand it over to today's moderator, who's Bob Kobek, President of Mobius Vendor Partners and owner of CustomerCount, we have a short video for you.
Feedback from patients and families is collected in many ways and for various reasons, including, but not limited to, written letters, focus groups, patient and family advisor councils, phone calls, social media, narrative comments, online feedback and surveys. No matter what the vehicle, they should all lead to better management of expectations. Most organizations rely on traditional survey methods. Yet, the existing approach has limitations and, more importantly, opportunities you should consider, primarily managing actionable data to better manage your business. A key strategy is measuring not only episodes of care, but every step of the patient journey, including experiences between the episodes of care. Often missed in the feedback management process is making sure all stakeholders are a part of the overall enterprise management system. Customized reporting and clear accessible measurements help create equity and allows you to make appropriate and sustainable process improvements along the way. The ideal system would capture and report the experience of family members, as well as the partners who are critical members of the care team. When your organization is armed with reliable data, robust reporting, actionable results, proper feedback management, and a comprehensive understanding of the holistic patient experience, then ongoing process improvement and managing a positive patient experience, from contact center to discharge, is within your reach.
Okay, Bob, the floor is yours.
Thank you very, very much. As Tom mentioned, my name is Bob Kobek. I'm the president of Mobius Vendor Partners and Patients Count. And I'm here today with my very, very good friend, and I will also say mentor in many regards, to talk to you about enterprise feedback for the patient experience. What we're going to talk to you about today is to examine the importance and the value of the feedback and making certain that we've got everybody included in the design and implementation of a proper feedback, or some would call it survey system. The survey system that we're talking about is very, very different than the HCAP survey that you might be used to. In our particular case, what we're doing is measuring the experience in order to accomplish sustainable improvement, which is really designed then to enhance the patient experience and break down the silos through accessibility and sharing of data. And Anne is really going to be she's the centerpiece of this. It's right up her alley. And a little bit more about me, if we could move it on there, Yuri. As I mentioned, I'm the president of Mobius, and we're a 24-year-old business consulting firm. We're the guys, the people that will come into an organization, and if it ain't broke, we break it and fix it. I've been around the data collection area industry for 35, 40 years. I've built call centers and relied on data to operate those. I'm a member of several different organizations, including SHSMD, and I will say that I'm looking forward to learning in this webinar from my friend Ann, as I know you are too, because I'm new to healthcare and I can't wait to learn as much as possible. Now, about Ann, Ann is the Senior Vice President of Resort Operations for Raintree International, and she has been, prior to being in the hospitality industry, she spent, I think, 15 years or so, Ann, in healthcare, and all of it in measurement, all of it in research, all of it in data management. What's significant about us, both of us, coming out of the hospitality industry into healthcare, is that the hospitality industry was the very first adopter industry of gaining feedback to enhance a customer's life cycle and enhance their experience. So for the hospitality industry, like healthcare, retention and loyalty are very, very critical. So, Ann, I'm going to have a question for you here. Yuri, please. All right, we got a poll, and that question is, who are you? We kind of like to know who we're talking to, and it's important so that we can make certain that we're not leaving anything out, and more importantly, that we don't insult anyone's intelligence. So let's take that poll. And Ann, I guess when they're doing this poll, you and I are supposed to chat a little bit, you know. So we didn't really, you didn't really talk about the your healthcare experience too much. I knew that you'd done it before you and I met in hospitality. What were you doing?
Well, it was my first career, Bob. Right out of college, I started working in healthcare, and I was fortunate enough to be able to start training departments in 3 different hospitals. One of those hospitals being a major teaching hospital, which was very interesting. And we were able to create some very interesting collaborations between nursing and me, not coming from a nursing background, as the director of nursing education, as well as the training and organizational development for all areas of the hospital. So that's what my healthcare background.
So I mean, to me, I view you as a subject matter expert in measuring patient experience, customer experience in general. So let's go on then to your presentation, to what you're going to do, and talk about metrics a little bit. And what there are several metrics that you would measure. What are the most important ones?
Well, I think first and foremost, Bob, it's getting a clear perspective on what we're trying to measure. And that's the overall experience of whoever we're talking about. If we're talking about patients, if we're talking about, in our industry and hospitality, we talk about our guest. However we term the people that we're in business to service, we should be measuring how they perceive their experience with us. So I think some of the things under that would be quality, would be accessibility, would be how the guest was treated with courtesy and dignity and that type of thing. But you know that each and every one of those topics could have a multitude of questions under it. So this really pertains a lot to the design of the instrument that we want to use to collect the data. And Bob, I think you know as well as I do that we could spend a whole session on just the design. But I think today what we'd like to focus on is what we do with that data once we collect it. How do we manage it? How do we make the most of the data that we're collecting?
Yeah, I mean, we do know, and that it's part art, part science, and there's a delicate balance between the two. I mean, you've got to be. I know that we have to be very careful about the way we ask questions, not only what questions we ask, so they're not so what, and so that our clients aren't talking to themselves. When you're designing your feedback, do you have the opportunity to work with your clients?
We have, yes, we can do focus groups and that type of thing. And
Next slide, Yuri, please.
yeah, I think this is the one that we were talking about. Question 2, able to manage the feedback.
Yeah.
Okay. I think, Bob, I'm going to piggyback on your comment about designing the questions is very important, because as we know, let's just use an example. If we want to know from a patient how they felt about the comfort of their room, we have to design questions that give us that feedback in the way that we want. What are we measuring actually? I mean, it could be anything. To a patient, comfort could involve housekeeping. It could involve the comfort of the bed. the nursing attention that they receive, the food service, any number of things. So I think that you're absolutely right. The structure of the question is a critical part in determining what feedback we're going to get before we even determine what to do with this. So I think that needs to be looked at very, very closely.
And so then here comes the tricky part to me. To you, probably not as a professional, but to me, it's a little tricky in that the process is always going to include a stakeholders, which is what we refer to as enterprise. So you're going to have marketing, you're going to have patient experience, you're going to have a call center, you're going to have different stakeholders throughout that organization. How have you been able to break through those silos to make sure that we're getting the cooperative efforts when we're talking about feedback?
Yeah, and I think that goes on to our next question. We've been able to, number one, look at each question that we have on our surveys or data feedback instrument, whatever we want to call it. And for every single question that you should have a list of stakeholders that apply to that specific question. So we begin with that and looking at, okay, this question could be impacted by the behaviors of people in housekeeping, in maintenance, in a variety of areas. In the case of hospitals, from nursing, from physicians, from a host of people. So we have to know who those stakeholders are to be sure that we're going to utilize this data to the best advantage.
So I should point out here, maybe I should have pointed out a little earlier, that what we're talking about is regardless of the vehicle you use to gather that feedback. It could be an online feedback system like ours, or it could be a group, or it could be done by the mail. But regardless of that, you need to bring everybody in, regardless of the vehicle, right?
Absolutely. Absolutely.
I mean, don't be afraid to try new stuff.
Yes, and we try new stuff a lot.
Well, I think we call that A/B testing, don't we? Something
Yes.
along those lines.
Something along those lines, yes, absolutely.
I mean, take a second and talk about A/B testing and how important that is, particularly. I mean, I know it's when we're not really scripted for that, but that's something that a lot of people don't really fully understand, and they don't understand how easy that is.
Well, why don't you take that one, Bob? How do you encourage your clients with A/B testing?
Well, the goal obviously is you got to start with the output. I mean, it's like any good effort.
Absolutely.
Do what you want and work backwards. And so whatever vehicle you can use to get the highest number of responses is what you want to use. And you want to try one way and try another way, and don't be afraid to try it in different ways. And that's A and that's B. So from an A/B testing standpoint, and that could include different questions. That could include different delivery vehicles. It could include any variable that you might think of that you want to test in order to get the highest response and the best data. I'm asked the question, Ann, and I know you are too, how much data is enough? And my answer is one more than I've got. So if I can use testing to get the highest response rate, then I certainly will.
Yeah, and I think that is extremely important, Bob, that we get enough data. And quite honestly, I find some of my most valuable data when I'm looking at feedback from my customer is through the verbatims. And not all instruments include an opportunity for our guest or patients to give us that verbatim feedback. But that's a very, very important part for me. And you have to be very careful about how you word those questions too, and the design of the questions, as we mentioned before, depending on what exactly you're trying to measure. So we take that very, very seriously and keep trying different things.
And those verbatim questions can, I mean, be the simple Boolean logic, if this, then this, what would you say, right? I mean, it could
Right.
be, it could be simple. It doesn't have to be complicated as long as it doesn't appear to be a so what question. It's really got to have purpose. The
Exactly.
question does.
And it can't be a leading question that makes the patient or the guest feel like we're digging for a specific answer. No,
Yeah, and this is going to sound a little shameless, and I don't mean for it to be because, because it's very important. If you're going to have patient satisfaction surveys, I'm a believer that bring in somebody from the outside, outsource that, get somebody in research, get someone in training, get someone that understands the nature of feedback and surveys. That's even true and even more true if they're doing an employee experience survey versus or patient survey at the same time. I'm just, obviously a believer in outsourcing.
right. And we do outsource, but you also, along with that, that's the beginning part. The second part to make it valuable is the kinds of things that we're talking about today, is how do you manage that feedback to get results, to get measurable or sustainable, actionable things that you can use to improve your organization or your services or whatever the specific data that you're collecting tells you. You have to know how to manage that.
Well, and of course, I think loyalty is the ultimate game. Um, loyalty, establishing trust. So when you're writing and putting your questions together and you're talking to all your stakeholders, making certain that they understand that the end game of this is to have enough trust. And if, for instance, you're billing Medicare, you're getting them to the point where that customer experience was nice enough that that Medicare survey is easier to do. So let me ask you now, move over just a second, if we could, to the what. Um, there are a lot of reasons why people will do patient satisfaction. There's business process. Every stakeholder is going to have a different purpose, really. But at the end of the day, how do you make sure that your purpose, that you're staying on task, that what you've done was you've designed it for process improvement, and you can go to the next slide there, Yuri. Thanks. That you've designed it for process improvement um, and it's working, and it's being consistent, staying consistent. We'll get to the poll here in a second.
Yeah, and I think, Bob, again, that has to do with what you do with that data and how you utilize it and how you structure it. For instance, we have worked very hard to make sure that I think stakeholders is just key to the value that you get from feedback. If you're not involving your stakeholders, then why do it? It's not one person's responsibility to yeah, we can have one person in charge of managing the overall process, but it's everyone's responsibility to fulfill the goals that we have for collecting data and for the experience that our guests have. For
So,
instance, sorry.
go ahead.
For instance, in our organization, there's one thing that we have as, I guess, a philosophy or a cultural implication. We have told every employee that works with us from the very, very bottom of the organization to the top of the organization that we all have the same job. And that job is to create the best experience we can for our customers, or in your case, patients. So if we have that mentality that we all have the same purpose, we have different functions that give us the results that we want, but we all have the same job to create that experience that is the best it can be for our, then I think we start off with a good foundation.
Tom, can we restart this poll, please? Is that possible?
Yeah, sure. 1 second.
kind of blew right by that, didn't I, Ann?
That's all right.
I don't get to do this every day. This, I will tell you, this is fun, and I, I appreciate it. Okay, there's the poll question. When we're talking about breaking through silos, we're talking about, to me, in a way, we're talking about how convenient is it. So, I mean, what do you have to go through to? I'm not talking to you, Ann, because I know that have to we have to encourage and cajole and beg and say, have you talked to the marketing department? Have you talked to the whatever department? And please get their input. So I'm curious to know what the audience has to say about what do they have to do.
The most important, yeah. Well, yeah, I think there are some, yeah, well, let's see what the audience has to say about what they feel the most important element in breaking through those silos. But there are a lot of things you can do, Bob, with the structure of your instrument. For instance, we have alerts that go out to all of our department heads and key executives when we get, our scale is on a 1 to 5 scale. And if we get anything that's below a 4, our people get an alert. And it looks like our audience agrees with what my answer to this question would be, and that's all of the above. You know, a comprehensive process, staff recognition, executive involvement, all of these are critical if you want to get everyone in the organization involved. So with our alert system, when people are alerted that they have a score that's below a 4, that's not acceptable in our organization. So the alerts go out, and also our department heads meet weekly with all of their employees to go over every single survey response that we've had that impacted their areas. So in addition to going over that, we have training as a critical thing. They have to do a report every week on any scores that were below a 4. Now that report indicates what the issue was. And this is one of the things that we think is very instrumental in making our program successful. And that is, they have to call the guest to find out if we didn't have verbatims that explain why they rated us low. They have to call the guest to find out what the problem was. And then in that report that they give weekly, they also have to give an action plan of how they're going to keep this from happening in the future. For instance, if it was an individual that neglected something or caused an issue for a guest, then they're going to have to go through some additional training. We have extensive training. We have videos. We have all kinds of training tools that we have our people to go through in terms of knowing how to deliver what is expected for their area.
And you use the report data to help you build that training?
Absolutely. Yeah, we depend on our feedback very, very much in our day-to-day operations. Now, the other thing that I'll say about this is that it's also important to have recognition for the positive feedback that you get, not just the negative, and not just always emphasizing you have to do something better or you did something wrong. We recognize each of our employees that are mentioned by name by one of our guests is given recognition. They get a point for each time their name is mentioned. When they have accumulated 5 points, they get a silver pin. When they accumulate 10 points, they get a gold pin. And it's a pin that says quality service, and they wear it with pride. And that's really something that has become very, very important to our employees. At the end of the year, we also, at each of our properties, we recognize the employee who has had the most personal comments made about them, positive comments made about them from our guests. And that's a big thing too. I mean, people wear that with pride. The other thing, because our scale is a 1 to 5, we have all of our employees wear a pin that says, "We strive for 5." And it creates some conversation between they and the guests. What does that mean? And they explain it with pride that we want to provide everything that you expect while you're with us in a way that makes you feel good about us and your experience with us. So to get people excited about that, we even have our employees design. Every 3 years, we change the design of our pin, and our employees submit submissions for that design, and we pick one of the designs from our employees.
Huh. So the feedback is not just the typical survey as a survey may be defined. It truly does. It truly is enterprise. You're using it to gamify employee satisfaction. And so it impacts the employees, which then of course positively should impact the patient or the customer or the guest,
Absolutely.
which then should make their life easier, better, and getting back to that loyalty thing.
Well, yes. And for our employees, I mean, let's face it, the employees, I don't care what kind of an organization you're in, whether it's, a hospital, as we're in hospitality, it could be resorts, hotels, a supermarket. Anybody wants to create that loyalty, as you say. You want to have those people, when they need your service, they think of you first. And the only people who are going to be able to make sure that that happens are the people who work in that facility. And you have to establish a way to make them feel a commitment, a responsibility, and that this is their job and that they have pride in that.
Which leads us to potentially to a topic for our next WebEx with SHSMD and the employee experience feedback, which is equally as important. So moving on in this particular instance, one of the things that I find when I'm talking to my clients is that I will ask the executive of that group, that pod or that entire organization, the CEO, whatever, if they're getting the reports, if they're looking at the reports. And very typically what I get, the answer I get is about the reports I want, the stuff I want to look at, I get them emailed to me. I haven't logged into the system forever. Okay, that's fine, I guess, from a management standpoint to look at those things that are the most critical to you and to your job. But how critical is it that the executive team push? And this is one of those questions that's going to sound trite, but it can be very problematic in a lot of organizations, that the executive team not only buy into this, what you're doing, but they support it, they push it, they talk about it, they memorialize it, they socialize about it. And so that's kind of how do you get the executive team really engaged?
Yeah, and I think, Yuri, that's our next question that we were going to talk about, and that's ways to get the executive team to demonstrate commitment. And I think that, again, it is a cultural thing. You have to embed that into the importance of the organization, that feedback and, making the experience an important part of what you are delivering. It has to come from the top. If it doesn't come from the top, then how do you expect people at any other level in the organization to embrace that and to see that as a commitment and a responsibility? So in our organization, for instance, my position is over all of the resorts, and I personally read every survey every day. So that's quite a commitment to make, and especially if you're in a large organization and maybe it is not feasible for large hospitals for one person to read every survey, but you can get the reports to the people that need to see them, and you can set up like in my situation, I require our executive teams at the hospitals to, or at the hospitals. I don't work in hospitals anymore, do I? That's been a long time ago. At our resorts, I have our executive teams to meet with their key people, their operations committees, every single week and review all of the reports, all of the things that they have received in terms of feedback, and talk about how they're going to address those. And then that becomes a part of the report that they send to me. And then from the executives, it pushes down to all levels of the organization. So the executives take it back to their team leaders. They work with their subordinates, and everybody gets involved in it. And again, if I didn't insist on that, it probably wouldn't happen to that level. So I think
I would imagine that's one of your greater tugs of war internally is to, you know, when you look at people, did you look at your reports today? I mean, you don't want to say that, but you almost feel like you have to.
Yeah, but you know what? You can influence that behavior again by making it a part of life and an expectation. It's not something that we do when we have time. It was really difficult in the beginning. I will admit that it was difficult in the beginning to make people realize that they needed to do this on a regular basis, that it's part of our routine. But once they got into it, and again, I think the way that we've been able to make this successful is that we don't use this just as a punitive tool. We use this as a tool to recognize our employees and to point out when they've done something excellent. We send personal notes. We have celebrations. When I visit the resorts, I always pick someone who has had positive comments from our guest, and I take them to breakfast one-on-one, and I have an interaction with them. Just little things that you can do that aren't costly, but ingrain in people that this is critical, that we all join together to make sure that we're addressing and utilizing this data to improve, as you said in the beginning, Bob, to improve our overall operations and our efficiencies. It can improve our efficiencies. It can improve the overall experience of our guests or patients. It can improve the staff sense of ownership and commitment. It can improve the loyalty that our customers have to us. So I think that this is very important. Can you tell I'm pretty passionate about this?
Well, I know you are passionate about it, and you know, for good reason. You know, and I know that one of the other things that you didn't mention, but I know it's important to you because we do work together, and that is the retention factor, employee retention, and how those surveys and the customer feedback or patient feedback can help you establish loyalty, greater loyalty with your employees. So
Absolutely.
they're more likely to stick around.
Mm-hmm.
And it's as much about training, which is, I know that's your real sweet spot. It's as much about training as it is process improvement. And so if you can train, that will help the retention, increase the retention. Obviously, there's a significant ROI, return on investment, to that. So I have a question, and then we have a question from one of our friends in the audience. You mentioned at the very, very top, as you know, I come out of the call center industry as my background, and in the call center industry, we call a lot of the elements of measurement, we call them key performance indicators. When we started, one of the first slides was when you talked about the metrics, not matrix, metrics.
Right.
Is the metrics that you're talking about measuring, would those be similar to a KPI, key performance indicator?
In my mind, Bob, they're one and the same. Our metrics, if your metrics are not associated with KPIs, then why are you doing it?
So that's how you keep them from being, one way you keep them from being, so what?
Exactly. And they have to be meaningful. They have to be meaningful, and you have to make them meaningful to all of your stakeholders. I'm a big proponent of getting everyone involved in this process. And a process will allow you to do that.
Yeah, because if it's an orphan in one department, I mean, if all other departments are throwing their arms around a feedback system, but if it's an orphan someplace else, it can defeat its purpose.
Right. And you never want to hear one of your employees saying to a guest, to a patient, that's not my job. You know, and then you'll know you have broken through those silos when you don't hear that being said in your organization. Even if it's not their function and they don't know about it, let me find someone who can help you. That's what we strive to do, because otherwise, as a matter of fact, I read a comment the other day on one of the surveys that I was reading that said one of the employees responded, oh, was it about a housekeeping issue? And the employee responded, oh, we cleaned that before you showed up. It must have been a maintenance man that left that in there, and didn't offer any response. That was not acceptable. And we made it very clear that a response like that is not acceptable. It's, let me take care of that for you. I'm so sorry that happened. And that's what I expect all of our employees to say.
Fortunately for me, I've never been on that side of a conversation with you, but I imagine it's probably not real pleasant.
On the other end,
Yeah, I've been on the other side of that. So the question we have from an attendee is the difference. I mean, hospitality is not healthcare, and healthcare is not hospitality.
Mhm.
So recognizing that we have some differences in the types of service and things like that. And kind of to me, the question leads back to the key performance indicators. What are the similarities between the two?
Well, and I think that for any type of business, the similarities are that you want the people, as we started out by saying, the people that you're servicing, and in the case of hospitals, it's your patients. You want your patients to receive the best experience that they can possibly have, given the fact that you have a huge challenge to begin with, because they're there because they have a problem. But you want to make that experience as easy, as comfortable, as fulfilling as you can under the circumstances. The same thing with hospitality. We want the people that come to see us have a good experience. Otherwise, they're not going to come back and see us.
Well,
Same
or
thing
worse,
with
they're
you.
going to ding you, or worse, saying they're going to ding you on TripAdvisor or Yelp,
Right.
or, I mean, they're,
Right.
you know, we give our clients, our patients, plenty of opportunities to hurt you.
Right. And that's the thing. And sometimes guys, I'm not trying to present a Pollyannish attitude here, but I do believe that there's the old 80-20 rule. 80% of your patients you can satisfy, and you can give them a good experience, and they'll go away if you're addressing the issues that they have. But then there's that 20% that we know no matter what we do, we're not going to satisfy. And that's one of the things too that I have had to work hard with our teams. And that's, don't focus on the one negative that you have. And that's where the reporting is very effective. When you can see, okay, I've had this, I look for trends. If I see the same thing coming up time after time after time, and I look at my reports and the scores are going down, 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 then I know that I need to do something to improve that action. And I would assume it's the same with hospitals or any other business. You want to monitor what your feedback is telling you. And if you see trends, then it needs to be addressed, and addressed quickly, the same as it is in hospitality. So I think the mechanics of what we're doing and the fact that we're collecting data to improve the overall experience that one has, I think that's the common denominator for anyone collecting
So
data.
Tessa asked a question from me and you, and I'm going to let you do it. And if you want me to follow up, I will. What Tessa wants to know is with partners who have seen the data and still are insistent on doing what they think is best instead, how do you help to drive them toward data-driven decisions?
Yeah, and who, I'm sorry, Bob, I didn't hear who you said was,
Tessa.
okay, no, yeah, Tessa. Okay, but read again for me, Tessa's question.
Partners who have seen the data and still are insistent on doing what they think is best, how
Okay,
do you help to drive them toward data-driven discussions?
yeah. And I would think that, it's going to happens in our organization. But I think one of the examples I will give you, and I had this just not too long ago with one of my general managers, and believe that no, I don't need to do this. I don't need to do this. And I actually had to have a sit down one-on-one. Now it's a little easier unless you're talking, Tessa, about a large group of partners. If you're talking about one partner, then it's a one-on-one conversation. And you have to have your ammunition. You have to have the data in front of you and say, this is not coming from me. This is coming from our patients, the people that we're here to service. So are we committed to responding to what their issues are or not? And this is this conversation that I had to have with one of my GMs, a very strong person, and believe that, I don't need to change it. This is the way we do it. It's always done this way. So,
I will add to that and have them answer the question, why is your way better when I can demonstrate to you with real data, structured data, not unstructured data, that I can prove to you that your way is not getting it. I don't know if that would fall on deaf ears. I mean, that's kind of a geeky way to approach it, I think. But then again, if you're going to be serious about data, you kind of need to be a little bit of a geek.
yeah. I agree with that, Bob. That's an excellent approach. Sometimes you might have to put those people in front of the people who are indicating that it's not the right way to do it, such as we have our department heads call people who have complained about this and find out why. Listen to their side of the story. Understand what would have made their experience better, different, if it were done a different way.
Have you, I don't know if it would be appropriate in healthcare at all, but have you tied certain survey responses, certain KPIs or metrics to bonus to pay?
We have not, in terms of just simply that, just the survey. We kind of do, because the performance that is expected out of all of our departments and individuals is tied into our survey questions. So the higher the surveys and the higher we perform, then the greater the potential for bonus and performance evaluation is. And we do ask questions on our performance evaluations for all of our employees. We rate them based on their customer interaction and customer feedback.
So Tessa, I don't know if we answered your question. If we did, great. If we didn't, you're welcome to do a follow-up, because we're about ready to wrap up, I think. Can we go to that call to action slide? There we go. We've got another 10, 15 minutes that we're happy to spend. And if there are no questions, we'll give everyone your 15 minutes back. But I did want to point out that what we're talking about here is enterprise feedback management. We're talking about, when we talk about enterprise, we're talking about all stakeholders. So Anne, when she was mentioning things, everything from how you make the decision to how you deploy to how you manage it, it needs to be company-wide and system-wide. So my email address is at the bottom. If you'd like a copy of the white paper on enterprise feedback management, I'm happy to send it to you on the house. Just send me an email at bobkobek@mobiusvp.com, and I'll attach it on attach it back. You can also we have a YouTube channel. You can find a video on it on our YouTube channel. So if you're looking for any sort of collateral material to go along with the information that we presented today, here it is. We're proud of it. And the people that have looked at it have told us it's very helpful to them. So any questions, any follow-up? Ann, what else you got to say?
Well, just kind of winding up, Bob, I think that the message that I hope to convey to folks today was that we may have different types of instruments that we use to collect data, to collect feedback from our patients, from our customers, whoever we're servicing, as I've said. But the critical part is, what do you do with that data, and managing it and utilizing it and making sure that we're not just collecting data for the sake of collecting data. And it requires, I think, a lot of training, a lot of getting all of your stakeholders, as you have said, Bob, involved and committed and taking responsibility. So I hope that we've conveyed some helpful information, some useful information. And if not, I thank you anyway for the chance to just talk about my passion.
Hey, I'm enjoying this too. It's always good working with you. It's always great, and with Yuri too. Kind of like, it's sort of for me to put a little bit of a wrap on it. The idea behind feedback is really surrounds the one word called listening. And listening is such a critical component in business that if you're not doing a lot of listening, you can't fix processes, you can't be innovative, which means you can't really attract and keep new customers, new patients, and particularly the keeping them part. And the other thing is, with the proper feedback mechanism and the proper process that you have in place, you don't have to necessarily add to your head count. You can keep your head count and you can manage it very, very cleanly if you set it up, the entire process, and if you set it up right in the beginning. So that is what I got to say. And if anybody would like to throw in any last questions, or your comments would be very helpful too. By the way, obviously, I haven't mentioned, I don't know that I'm allowed to mention that Patients Count is an online feedback system. So that's why I'm here, is because we do have one of those vehicles. And again, there are others. So Tom, I hope I don't get dinged for that last little blurb, but I figured it'd be worth trying to get it in. So I appreciate everybody's time. Ann, I appreciate your time. Yuri, appreciate your time. And Tom, especially to SHSMD for this opportunity.
All right, thanks, Bob. And no worries, no dings, but just a big thank you to Ann and Bob for sharing your expertise with us today. And another thank you to Patients Count by Mobius Vendor Partners for sponsoring today's program. Please complete the short survey that will launch on your browser as soon as this webinar closes, and recording plus the slides will be shared via email later this afternoon. So that concludes today's presentation. Thank you, and wishing you all a great afternoon ahead.
Thank you.
Thank you.